Good morning, Dr. Patino here at the Cosmetic Surgery Cerritos. So we're going to do microparasitic liposuction to the abdomen. This patient is not really a very good candidate because she has significant excess skin. I recommended a tummy tuck. She refuses. She accepts excess skin and irregularities as a result of these. I usually don't like to do these cases for that reason, but she has realistic expectations. She's planning to have children, and she will later on get a tummy tuck, and we'll see what we can do. We're going to do laser assisted lipolysis as well. This is microparasitic, so you can see how I turn it on and the tip vibrates. It's like an electric toothbrush. The fact that you have an electric toothbrush doesn't mean that you're going to use it as such. So it's important to use the toothbrush appropriately. So it's important to use this instrument appropriately, right? If you have a toothbrush that's electric and you jam it at full force, back and forth at full speed, there is going to be gum bleeding, right? But if you just let the tool do its work, then you're going to have an output that is going to be completely bloodless. So that way you're going to prevent the anemia, postoperative exhaustion, because the patients, they just can barely move. They're so anemic, right? With the traditional technique. But with this technique, you minimize the bleeding. I think it's unnecessary blood loss. I know it's unnecessary blood loss with the traditional technique. So even though we're not going to do a fat transfer to the buttocks, we still would love to have a completely bloodless aspirate, so that the patient doesn't have anemia, right? So that her risk of blood transfusions is much less. So that the risk of reoperation for bleeding or hematoma is much less. So that the risk of infection is also much less. So it's this is probably the most important part and most difficult part about this technique, is to find a patient surgeon that can do this slowly and meticulously. I am meticulous to the point of being ridiculous. And so it has many, many advantages, not just because of the anemia, but also I would argue that it would be extremely difficult for a surgeon that's operating at this speed to perforate an internal organ, something that we've never done. But it usually happens to a very tired surgeon that after doing many cases in one day, perhaps on a Friday night or Friday afternoon, after being tired for the toll of the entire week, and maybe on their 10th or 13th case of the day, going at full speed, maybe hungry, maybe sleepy. It's like driving on the freeway at 260 miles an hour. Some people can do it, expert car drivers and that sort of thing, and most of the time nothing happens. But when it happens, the consequences are terrible. So when you go at full speed in a car, you can lose control of the vehicle and go to an unintended area. Very much the same here can happen during surgery. You lose situational awareness, and the cannula goes deeper than you want it to. It goes into and perforates maybe an organ, usually the intestines here in the abdomen, but it could also be lethal here in the abdomen, but also in the thorax. God forbid you enter the thorax and go into the lungs or the heart, something that we never done. So we never had anybody die. We never had any intra-abdominal or intrathoracic organ perforation. Thanks to God, we want to keep it that way. But there is many things that go into these. The most important thing, again, is the surgeon. We just operate on 1 or 2 patients a day. That's it. But that's why we can have the luxury of going slow and protect you. I can go very fast also, but I don't want to. This is not an emergency. This is not something that you need to do very fast, you know. So our times are still very, very comfortable, because you don't also want to go too slow. If you go too slow, then you prolong the surgery. As you prolong the operative time, the risk also significantly increases. So it's a medium. I would say that there is 2 types of surgeons. Those surgeons that drive at 75 to 80 miles an hour in the freeway, that's a great majority of surgeons. I would say that's probably 90% of surgeons. And with those surgeons, you probably can expect maybe to lose 2 cups of blood. You're probably not going to need a blood transfusion. But then there is surgeons that drive maybe 260 miles an hour, right? And with those surgeons, you're going to lose the entire blood volume, maybe up to 5 liters of blood, and they usually recirculate the blood, so you would know because they'll tell you, we will transfuse your own blood during surgery. That to me is a red flag. That means that they are going to expose you to the limit, right? It's something that is very common, that is routine when you do open heart surgery, for example, where your heart and lung machine will recirculate your blood, but and that for open heart surgery is necessary, right? But not for these types of surgeries. These patients are, cosmetic surgery patients. You don't need to put them to that extreme, in my humble opinion. But what happens is that when the blood hits the hard walls of the heart-lung machine, the platelets break down, right? And the red blood cells also break down. And then there's more risk of bleeding. And on top of that, usually these patients receive heparin and receive an oxygen. So if you receive blood thinners, no, impossible. You're not going to have this output. Impossible. So some surgeons prescribe routinely aspirin and ibuprofen and herbs and vitamins. We don't do that. We do the opposite. We tell patients to stop all vitamins and all medications. There's a huge list of medications that can thin your blood. So we give that list to the patients so that they don't take any of these medications for 2 weeks before and 2 weeks after the surgery. And the surgeon himself, I don't give any aspirin-like medications, ibuprofen, herbs. We also ask our patients not to take any teas. This chamomile tea, for example, very common, right? That would also give you bleeding. So no herbs, no vitamins of any kind, super important. And also, very important is the anesthesia team, right? So we have an amazing group of anesthesia providers led by Amin Azam, who is the owner and manager of Sedase Anesthesia, which I highly recommend. These anesthesia providers are incredible. So they coordinate with us. We see the patient preoperatively. We assess the patient. I do 3 complete exams, right? One at the time of the consultation. Then that's a focus exam. And then we do a more intense exam, but also a focus exam. And then we do a preoperative complete history and physical exam. And then at the day of surgery, we do a more limited exam of the heart, lungs, and airway, right? And so and we plan the surgery with the anesthesia provider. So I could do everything right. Look at this output. It's incredible. It's incredible. I can do everything right. The patient can do everything right. But if the anesthesia provider cannot control the blood pressure, and the blood pressure is sky high, this output is going to be bloody, okay? But look at this. This is incredible. I mean, what, do you see any bleeding there? Do you see a speck of blood? Please let me know. A speck of blood. Completely bloodless, aspirate, and that has many advantages. Let's say if we're going to do a fat transfer to the buttocks, right? Then you definitely want a bloodless aspirate, because if whatever goes into your buttocks is red, then that means that it's a mix of fat and blood, and obviously initially the buttocks are going to look great, right? And then once the blood gets reabsorbed, you're going to end up with losing maybe 25 to 50% of the volume, right, on the buttocks, right? And that has to do, some of it because it's blood that you put it in there that doesn't belong in there, but some of it also is that the fat is being collected in such an aggressive manner that the fat cell dies. So they put the fat, but the fat cell dies, right? Or it may be also that the fat that doesn't belong outside the blood vessels, when it's in the buttocks and the subcutaneous tissue, the body recognizes that blood as a foreign substance and starts rejecting it. It may cause a callus, a wall, if you would, like when you have a fragment of a bullet or a glass fragment inside the body. Usually what it does is it basically forms a wall, like a callus around it and pushes. Incredible. And this is not just one case. We're not selecting our cases. This is pretty much, you can see it on YouTube. Pretty much every case that we do, this is really a technique that I developed over the years. Since 2004, I've been doing this, and it's incredible. Thank you. This area is half done. It's not completely done, but you're gonna see the difference, right, between this area and that area, right? So look at here, you know, this is the iliac crest. We have a nice depression. I'm giving her a little bit of high definition, yet she's not really a candidate for that because she has excess skin. And but look at this. See, the pinch says here. Like I said, I still gotta do more, but it's pretty close to a half a centimeter. Whereas look at this here. Look at this. Look at all these fat, you guys. I cannot even press. You know, it's a huge difference. So you see the difference between here, right? And this area is not completely done. I still gotta work on it. I'm literally like maybe 3/4 done. But just to show you the difference, here I cannot even pinch. It's impossible. So much fat. Look at that. Look at that. Look at all. This is the pinch on this girl, right? Compared to this, right? Amazing. Thank you. Wow. And AJ, have you seen liposuction output like this before?
Never like this.
It's incredible. What impresses you about this, AJ?
I don't see any blood.
AJ Pal Singh is our anesthesia provider today. Completely bloodless, huh? It's incredible. Yeah.
So our blood pressure is well controlled. That minimizes blood loss and risk of transfusion. Dr. Patino provides tumescent anesthesia, which lowers the need for narcotic in these patients and decreases the risk of nausea and vomiting.
So we make the management of anesthesia easier on you.
Absolutely.
And you make the surgery easier on me by maintaining the blood pressure, right?
Absolutely.
But look at this. I am impressed myself. This is almost white, you guys. This is almost white. I mean, there is not a speck of blood. This is just unbelievable. Completely bloodless. Pale. I would say it's pale fat, man. Pale fat is what we see here at the Cosmetic Surgical Center of Costa Rica. If you would like to have a procedure like this, please give us a call, 510-525-7999. That number again, 510-525-7999. And look how comfortable I am here. I'm not sweating it. I'm not rushing the procedure. So this is also not only good for the patient because it prevents injury to intra-abdominal or intrathoracic organs. Of course, we're right now we're in the abdomen, so we're not even near the thorax. But you can even go into the thorax through here if you're not careful and you lose situational awareness, you know, and which could be fatal. You know, when that happens, the patient just dies, and we never had anybody die. We want to keep it that way. But I'm not rushing you guys. It's not like I have 10 more cases to do. No, this is our only case for the day. So we take it easy. We enjoy the surgery. The patient totally is not rushed. Yeah, we put her favorite music before she came in. We warm her up nicely. So she's very happy, very jovial. We relieve her anxiety. We offer movies so they can watch when they're getting ready for surgery. Or when they come into the operating room, they're warm and cozy and just happy with their favorite music. We tell them, you know, you're the queen or the king for the day. You decide what to do, you know. And so they choose their own music and that sort of thing. And she even asked me to pray for her. So we did a beautiful prayer for her. That's something that I routinely do for all my patients, regardless of their faith. I pray for them. I commend my hands to God. I went to Mass this morning. I kneeled down and I received the body, blood, soul, and divinity of our Lord Jesus Christ. And I said, Lord, help me. Guide my hands in this case and protect my patients every day. And I believe It happens. I feel the hand of God protecting me. I do feel it, you know. And look at this. It reflects on this. This is very unique, you guys. I honestly have never seen any surgeon do this. I'm not bragging. I'm a humble man. And I know it's not me. I know all that we do is we owe to God our Lord. But we gotta tell you the truth, you guys. And you gotta see it too. And you gotta see how many benefits does this have for you, okay? Because if you see red, that's unnecessary blood loss. We can do this consistently in a bloodless manner, and I have the test of time. I've been doing this since 2004 in this very way with incredible results, and it only gets better. And it only gets better as I refine my technique. Another tip for surgeons out there is that, you know, most surgeons are ambidextrous, but even if you're not, using both hands will limit also occupational injuries in the form of tendinitis to the elbows, shoulders, or wrists, which is common when you do this, especially if you do 10 cases a day. Of course, yeah, you're gonna you're gonna have tendinitis, right? And so this is good because if you use your non-dominant hand, it's going to force you to go slow. And when you go slow, you're going to protect the patient. You're probably going to get this type of output, bloodless and beautiful, right? This is just an unbelievable way to do surgery. And we would love to see you. We would love you to benefit from this procedure. This is the way to go. This is the way to do it. And we're going to give her some definition here, but it's going to be hard because she has excess skin. And she really does need a tummy tuck. But you know what? To my surprise, she's looking pretty good. And we're later on going to do some energy device. We're going to use smart lipo, which is what she wanted to, you know, hopefully retract this skin, this excess skin. But at the end of the day, she's probably going to need a tummy tuck anyways, right? But the laser will retract the skin to a certain extent. The good thing about her is that she's young. And so the skin still has good elasticity, although, I mean, you can see a lot of laxity, right? From prior pregnancies and that sort of thing. So anyway, so we would love to see you. Please give us a call. Operators are standing by. It's worth the trip. If you're coming from far away, we have patients. Yeah, for those patients traveling from abroad, it is really worth the trip because with us, you're going to recuperate a lot faster, right? And so it was much less risk and complications, so it is worth the trip. I normally do not recommend patients traveling, especially when they're operated on with the traditional technique. But with this technique, the patient can travel, and the risk of a blood clot, which is the thing that can kill you, is much less. Why? Because these patients of mine walk 1 mile the first day, 2 miles the second day, 3 miles the third day, preventing a blood clot. Because if you're in severe pain, then yes, of course, you're going to need blood thinners, you're going to need enoxaparin, you're going to need heparin. Because you're in severe pain, you cannot move. Or if you're in a hospital or a clinic facility where you're not allowed to walk around, then that's even more of a problem, right? Because then you're going to depend on the blood thinners, and then you get into other problems. You can get hematomas and bleeding and anemia and reoperation for bleeding because of the blood thinners, right? And of course, the output is not going to be this beautiful output. It's going to be very red. Thank you.